Good evening, everyone, and thanks for joining us here tonight for our webinar on leaky gut symptoms, causes, nutritional approaches that we're going to cover tonight. First, before we get started here, I just want to go over some housekeeping things. If you have any problems hearing or have any issues with it, there's a chat box on the right-hand side of your screen down at the bottom. If you want to go ahead and type you can hear us here, or that you are able to hear us, or where you're from, you can type that in there just to kind of get used to it that way. If you have questions for Dr. Bill throughout the presentation, you can put those in there, and he'll get to those towards the end of the presentation. So with that, I just want to introduce Dr. Bill Vandergriff of Equivision, Inc. He will be the presenter tonight, and he'll have a lot of good information for you guys to go over, and I'm just going to hand it off to him, and we'll let him take it away. Dr. Bill?
Okay, thank you very much, Chad. For those who may have attended the first webinar that we did on intestinal inflammation, and we did discuss leaky gut, there's going to be you'll recognize some of the slides in this presentation, but I used to teach at the university level, so I guess the way to describe that would be the webinar we did before would be Leaky Gut 101, and what we're going to do tonight would be Leaky Gut 201. But if you missed the first one, no worries, because I'm going to bring everybody up to speed, but I am going to cover leaky gut in a little bit more detail tonight, so hopefully everybody will have a much better understanding of what leaky gut is all about, because it's becoming a very popular term, and I've already run into situations where it's being misused a little bit, so hopefully we can clarify that. Before we get started with the webinar, a few disclosures so you understand where I'm coming from on certain topics and products really that we're going to discuss. But my primary function with Equivision is as a consultant for breeders and riders and trainers, not only nutrition, but also in the areas of general management as well as exercise physiology. And I do that on both a domestic and an international level. And through the activities involved in that consulting business, that's where our supplements have come from. Every single one of our supplements was developed because I had a particular client that had a specific need that needed to be addressed, and I couldn't find anything on the market, so we put it together ourselves. And after doing this for 30 years, you can imagine we've got a couple of products that have a more broad-based application, and those are the ones that we sell on the website. And also, just so you know, I am the consultant for Triple Crown. I'll probably be mentioning, or not probably, I will be mentioning Triple Crown feed at one point or a couple of points in the presentation. And so you understand, why am I recommending Triple Crown? It's basically because I'm the guy that formulates it. I know what's in it, and I know what it's going to do. Not to say that other feeds aren't applicable also, but I am obviously most familiar with Triple Crown. So you understand why I'm making that recommendation as we go forward. So what is leaky gut? Technically, it refers to increased intestinal permeability as a result of relaxation of the tight junctions, or what's called the epithelial tight junctions in the intestine. So when we say increased intestinal permeability, what we're referring to is the ability of bacteria, large proteins, other foreign bodies, so to speak, that would not normally be able to transfer across the intestinal membrane, can now get through the intestine and into the bloodstream. And so it's literally the gut actually leaks, and that's where the term leaky gut comes from. Understand there's many different causes of gastrointestinal dysfunction. Not all of them are leaky gut. For example, if I have a horse that colics due to an impaction, or he's got a spasmodic colic, that is obviously an intestinal dysfunction. That's not necessarily leaky gut. So we have to make sure we separate these things out. Also understand that leaky gut by itself is not an exclusive diagnosis. In fact, leaky gut's often referred to as a syndrome because there's many different things that cause it. There's many symptoms that are not exclusive to leaky gut. So you kind of have to play Sherlock Holmes a little bit, trying to figure out what's actually going on and actually see if leaky gut's a primary issue with this horse, or if leaky gut is actually secondary to something else. And we'll discuss that as we go through the webinar. Leaky gut often is a consequence of trauma or physiological challenge. Exercise, extreme exercise, whether it's an endurance horse or a racehorse, that activity will actually create trauma to the intestine and is a major cause of leaky gut. And also, leaky gut is often associated with other physiological conditions such as insulin resistance, allergies, and recurrent colic. And we'll discuss that in more detail as we go through the evening. But first, I want to cover, how do we identify horses with leaky gut? This is probably the most common question that I'm asked. And again, we have to go by symptoms, and here's why. Number one, no two horses present exactly the same. There are some common denominators that we look for that, kind of point us in the direction that we might have a leaky gut situation, but there's no ha-ha moment. In other words, if I see this, I know I have leaky gut. There's very few of those type presentations. So we have to take the horse as a whole and figure out what's going on. We can't use ultrasound. We can't use an endoscope because we can't get back into the small intestine. We can't get back into the large intestine and take a look at the inflammatory process. If we do ultrasound and we are able to measure a significant thickening of the intestinal mucosa, what that tells us is we already have significant inflammation, in which case at that point, yes, we will have leaky gut. What we want to do with 99% of our horses, though, is figure out what's going on and get it stopped and reversed before it ever gets to that point. So we have to use the behavioral cues as well as symptoms. Now, what about susceptibility to horses? What horses are more likely to have leaky gut? Imported horses, very common for them to present with intestinal inflammation and leaky gut. The process of being imported, going through multiple quarantines, puts them under a lot of stress. Race horses, other high performance horses that I've already mentioned briefly, very susceptible to leaky gut. Even if a horse is not really a high performance horse, but it tends to be a nervous, anxious type personality, that anxious, nervous personality is going to predispose that horse to intestinal inflammation or leaky gut. Post-colic horses. We mentioned that because a horse colics doesn't mean he's got leaky gut, but if there's been enough damage to the intestine as a result of that colic, chances are we're going to have some degree of leaky gut in a post-colic situation. Antibiotic usage, which we're going to talk about a little bit later. Chronic pain. The pain itself is a stimulus for leaky gut, but also most horses that are experiencing chronic pain are going to be treated with nonsteroidals. And long-term steroidal use is also a cause of leaky gut. Previcox is not excluded from that list, okay? It's not as bad as buterbanamine, but given at a high enough dose for a long enough period of time, Previcox will also create a leaky gut situation in certain horses. And before I go any further, I guess that point needs to be made. And the same holds true for bute as well as banamine. And that is, there's a tremendous amount of individual variability in how well horses tolerate the long-term use of those nonsteroidals. Some horses can tolerate it very well and their intestines are never affected, whereas other horses will actually develop intestinal inflammation fairly quickly with heavy nonsteroidal use. Equine metabolic syndrome. If you have a horse that's insulin resistant, chances are that horse has got some degree of leaky gut, and we're going to talk about that. Any horse that's under stress, and notice I've put that in big, bold, red letters. Stress is one of the number one stimulators for leaky gut from any source. Could be physical stress, can be emotional stress. Stress in general is a trigger for leaky gut, and we'll make this more clear as we go through. So what symptoms do we actually look for when we're looking at these horses? It may be nothing more than the horse is simply not performing up to its previous level or up to a level that should be expected. It's common for these horses to have personality changes to the worse, not the better. A lot of them get grouchy, they get snarky, they get a leave me alone attitude, whereas before they seem to be pleasant and easy to get along with. These same horses will show resistance to leg aids, often on the right side, but don't exclude the left. Now, understanding that many horses are right-handed, left-handed, what we're referring to here primarily is a change in the compliance of the horse, where before they would bend well, they'd respond to our leg well. Now, for some reason, all of a sudden, it's like trying to turn a 2x4 in one direction. And if you apply your leg, the ears get pinned, the head comes up. They let you know that, hey, that's not comfortable for me. That's a big cue to let us know that we've got some intestinal inflammation. When you're saddling the horse, he starts to show resistance. He might just back the ears a little bit. He may turn around and try to bite you. When you tighten the cinch, in severe cases, they may even try to cow kick you. And again, this would be a new behavior, something that they would not have done before. I've had some horses that have simply been dull. They really didn't show any other symptoms other than all of a sudden they just acted like, I just don't feel like doing anything today. And that would be their general temperament from day in and day out, whereas before, they were compliant and willing to go. A horse that prefers to eat hay rather than grain is another key tip-off. When you feed grain to your horse, we want them to go to it. We want them to clean it up. We want them to act like they're enjoying what they're eating. These horses will tend to nibble at the grain, go away, eat hay, come back, nibble at the grain, go away, come back and eat the grain type behavior. When I see that, I'm pretty sure I've got some hindgut issues. This is a bit in contrast with horses that have gastric ulcers. Those horses will tend to dive into their feed, in many cases actually clean their grain up, but then begin to show some discomfort either in the middle of eating the grain or shortly afterwards. So those are some of the behaviors we look for to differentiate. The manure will have a funny odor or consistency. That's also consistent with gastric ulcers, so that doesn't really differentiate between the two. You can look on the internet and there's products that are buffers or hindgut buffers, talk about fecal pH. Basically, that approach is valid, but keep in mind that pH is herd specific. So you can't just measure pH and say, okay, I've got a pH of 6.7, so I'm okay. You may actually have some issues at 6.7, whereas your buddy down the road, 6.7 may be A-okay. So before, again, that's not an exclusive deal. You have to take that on a herd by herd basis. A horse that stands in the stall, constantly switches its weight from one hind leg to the other, is another thing that we look for. Not consistent with all horses, but when I see that, I need to ask the question, okay, is this intestinal discomfort? Is this hock discomfort? Is this hip discomfort? Is it back discomfort? So again, there's many things that it could be, one of which is intestinal discomfort. Another thing I look for is a very tight and sunk in appearance in the flank area. And the picture of the horse that I have here is actually classic for intestinal inflammation or leaky gut presentation. This is a horse that happens to be in Japan, thoroughbred racehorse, successful, very successful racehorse. He's been racing quite a while. That's another cue right there. That predisposes him to leaky gut. But what do I notice when I look at this horse? Get my pointer back here. There it is. You'll notice in the flank area, now all race horses will tend to be tight in this flank, but notice this horse is very, very tight all the way up into the hip area. And it's a little bit out of proportion to what we see up in the front. So anytime I see this extraordinary, I'll call it, cut up and tightness in the flank area, I get very suspicious. You'll also notice he's starting to lose top line. And you can tell he's very tight in the hamstrings, which is another thing that I look for. Most horses that have intestinal discomfort, leaky gut, will be very tight through this back and down the hamstring. I've taken my finger and run it down this hamstring before on some horses, and they've almost hit the ground. It's been so painful to them. Now, one thing you can't tell from this picture is, as you can see, this horse is standing here pretty compliant. There's many people standing around looking at him. Didn't offer to get away. He's got his ears up. He seems to be doing fine. Again, experienced racehorse, used to a lot of activity. But when I approached this horse and tried to put my hand on him, he tried to go to the next country. He did not want to be touched. And that's another one of those symptoms we look for, is these horses get very, very sensitive to all kinds of touch. They don't want to be touched. Okay, other symptoms. Of course, eating a lot, but not gaining any weight. We see that. Dull coat and skin disorders combined with poor hoof quality, often combined with multiple allergies. A horse that's got multiple allergies, we are very suspicious that that horse actually has leaky gut. Now, as we've discussed, a lot of the symptoms that we've listed are also consistent with gastric ulcers. So it's very common for me to look at a horse that's been on omeprazole or Gastrogard for a while, but when I hear the comment that the horse did fine while on Gastrogard, but reverted very quickly after being taken off Gastrogard, that is a big tip that the primary problem is actually in the hindgut and not in the stomach. A horse that's got recurrent or chronic diarrhea, that's a tip-off for leaky gut, even more so than intestinal inflammation. Irreconcilable behavior. What do I mean by that? This would be a common behavior, would be a horse that previously had been easy to get along with, but now if you try to groom them in the side area, or just put your hands on them, they'll just all of a sudden reach around and try to bite you, and your reaction is, well, what was that all about? And that's what I mean by irreconcilable behavior. Another one, I had a stadium jumping horse, had been competing very successfully, developed leaky gut, and his irreconcilable behavior presented from the standpoint that if he even touched a rail, he would go into a very severe bucking fit. He just, any type of irritation, they become extremely sensitive to. Now, some of these intestinal inflammation, leaky gut, you can use some acupressure points to help cue you in, but again, they're not exclusive. They're just another tool in the toolbox you can use to help cue yourself in on what's going on. Now, this cartoon, those that had attended the first seminar will recognize this one. What you're looking at are individual cells in the lining of the intestine. And keep in mind, this is an important point. The intestine mucosa is only one cell thick. You've got the intestinal lumen here, you've got this one cell, and you've got the blood supply. So any challenge to these cells makes it very easy for bacteria, large peptides, fungi, anything that's not supposed to normally go through into the blood can now make access from the intestinal lumen straight into the bloodstream. It's these tight junctions that exist between these individual cells that keep those cells tight, keep them together, and prevent that from happening. When those tight junctions come apart, things start to flow through that aren't supposed to flow through. And you can tell this cell is a little bit redder than this one, indicating a certain degree of inflammation. This cell, again, is even redder than this one, and the cartoon illustrates that the cell itself is starting to lyse. So now we've got a major hole in the intestine where all kinds of things can now go through the intestinal mucosa into the bloodstream. Once that happens, you can imagine what that does to your immune system. It triggers inflammation and also triggers a blood-brain barrier breach. And I'll revisit it again later, but the same mechanism which breaks down these tight junctions to create leaky gut also breaks down the blood-brain barrier. So when you have leaky gut, you will also have leaky brain, which in part explains why you get strange behavior sometimes. Now, this is where we go into leaky gut 201 versus 101. A little bit more detail on the structure of the leaky gut, structure of the tight junction. But I do think, just going through this, it'll help you understand the dynamics of how this works. The tight junction, in other words, this is your individual intestinal cells. This is your tight junction area, and now it's blown up so you can see the individual components. These tight junctions are actually held together by over 50 different proteins. Some of these proteins actually, there's my pointer again. Some of these proteins actually connect from cell to cell, and there's a whole series of them, as you can see. Other proteins make up a protein ring complex. And keep in mind that, we're looking at this on a two-dimensional plane. The gut's actually three-dimensional. So while you've got all these cells lined up in a nice little line, you've got cells here in front, you've got cells here in back, and these protein complexes actually help combine or keep all of those three-dimensional cells together to keep them tight and prevent or decreasing intestinal permeability. Now, these proteins right here, known as the claudin, those are the workhorses of the tight junction. When those come apart, now you've got a major problem. When the occludin proteins come apart, the next thing is the claudin proteins come apart, and so forth. But what you basically want to understand is that bacteria from the intestine, proteins from the intestine, neural communication to the intestine, all of these factors communicate with that protein complex and affect the function of that tight junction. So that tight junction is regulated, as I just mentioned, by proteins, by endocrine messengers, and by neural signals. Now, the proteins can be bacterial source from the normal bacteria that live in the intestine. They can also be from systemic sources. And this is what we're learning about probiotics, is that a lot of the probiotics that are beneficial actually don't even have to be alive. The reason that they're beneficial is they contain certain proteins which interact with that protein ring complex of the tight junction and stimulate it to keep that tight junction closed. And those proteins can do that whether that particular bacteria is alive or not. There's also a lot of endocrine messengers. We have a lot of hormones that are produced in the intestine, and they also will send messages to the tight junctions in terms of increasing or decreasing permeability. You have a lot of neural signals. You've got nerves that travel between intestinal cells. You've also got the vagus nerve, which travels from the brain to the intestine, which will also affect those tight junctions. We've all heard the expression, when I got that bad news, I just got this pain in my gut. That's more than an expression. That's a real thing, because When you got that bad news, your emotions processed it in your brain sent a signal down that vagus nerve gave a signal to your gut, and bam, yes, you actually did have a pain in your gut. It's a real thing. And that happens under, shall we say, disease conditions. For example, we know for a fact that people that suffer from irritable bowel syndrome suffer from anxiety and depression. We now know that's neural regulated from the vagus nerve. And we'll talk about that more in a little bit later. But also keep in mind that certain stimuli can either increase or decrease tight junction permeability. And this is what makes leaky gut such a complex situation. As an example, in pig intestine, high levels of dietary tryptophan have been demonstrated to increase tight junction permeability. In other words, create leaky gut. However, that's in normal pig intestine. But if we already have an inflamed or leaky gut, and then we give higher levels of tryptophan than normal, it will actually close the tight junctions. So, you can't go on always just one thing. Omega-3 fatty acids in lower levels of intestinal inflammation will actually decrease tight junction permeability. In other words, close them up. But if I've already got active leaky gut and I give omega-3 fatty acids, I may actually make the intestine even more permeable or make the condition worse. And in my experience, that has actually happened a number of times, and we'll talk about that. So again, leaky gut syndrome from long-term or intense exercise is caused by changes in the protein ring complex. In other words, get my pointer here. Racehorses, endurance horses, all you marathon runners out there, this particular protein right here, light chain kinase is what that's called. Exercise creates changes in that protein, which then affects the claudin protein, which then opens up that tight junction, and you begin to get leaky gut. So in some cases, we know exactly what the mechanism is for why exercise creates leaky gut. Elevated cortisol levels. So if you have subacute chronic inflammation in the body, inflammatory cytokines will also affect those same protein complexes and also then create leaky gut. So as I mentioned before, the same mechanism which creates leaky gut breaks down the blood-brain barrier. So again, leaky gut often equals leaky brain. So this is where that off behavior, those different behaviors in the horses come from. And it's also why I pay a lot of attention to talking with riders, trainers, owners about any observations they've made in terms of their horse's attitude, compliance, etc. Okay, leaky gut and gastric ulcers. As I mentioned earlier, if I have a horse that the owner says, well, I've given him Gastrogard, he got better while he was on it, but as soon as I stopped the Gastrogard, he seemed to get worse again. When I hear that, I'm highly suspicious that we're dealing with a primary hindgut issue. And we now know a mechanism for why this happens. There's a hormone that's produced by the intestine, which feeds back on the digestive tract. That hormone is called glucagon-like peptide number 2. It's produced by the lower part of the small intestine, primarily the ileum. And its role is to feed back to the stomach and basically says, hey guys, I'm busy down here. You guys need to slow down. Give me time to do my job. But in a leaky gut situation, the secretion of that hormone, glucagon-like peptide 2, is affected so that the stomach never gets the signal. So the stomach stays active. It keeps secreting acid, even when it's not supposed to, and as a result, gastric ulcers develop. Now, those gastric ulcers are real, which means they do have to be treated. which is why you put those horses on omeprazole or nitidine or whatever treatment you're using. They do get better, but you haven't addressed the primary issue, which is the inflammation in the small intestine. So you still have to treat the gastric ulcer, but you also then need to treat that inflammation or leaky gut situation in the hindgut, or in the lower part of the small intestine. When you get that taken care of, then the two start to talk to each other the way they're supposed to, and everything gets better. Leaky gut and allergies. As you can see again from this cartoon, that when you get leaky gut, you can get large proteins, large peptides that now make straight access into the bloodstream. They're not supposed to be there. So your immune system recognizes, I've got a protein here that's not supposed to be here, and it goes on high alert. And the immune system for that horse basically becomes hyperactive, and they start reacting to everything. And remember, 70% of your horse's immune system is actually found in the intestine. Now, do horses actually have bona fide allergies? Yes, they do. Okay, so there are many horses out there that, when somebody says they might be allergic to alfalfa, for example, that could very well be a real thing. But when I get an allergy report sent to me, and the horse is borderline positive or low-level positive to about 35 different antigens, I'm pretty sure I'm dealing with a horse that's actually got leaky gut, whose immune system is on the blink. And if we can treat that horse, fix that leaky gut situation, calm that immune system back down again, we can solve a lot of those allergy problems in that horse. So if you've got a horse that's breaking out in hives from time to time, and you can't really identify one specific antigen that's triggering this, it just seems to be, especially if they're under stress and they break out in hives, that's usually a leaky gut situation. The vets tuning in tonight, I think, would specifically appreciate this cartoon. Do we treat this from a preventative standpoint, or do we treat this from a curative standpoint? For example, if we've got a horse with the hives, we want to give allergy shots, give steroids, we want to try to cure it. We want to treat that horse to give it some relief, which is an important part of the treatment process. But if the horse is uncomfortable because it's actually got leaky gut, then what we're doing is we're simply mopping up all the water that's pouring in from the leaky gut. So if we really want to help that horse, we've got to do the preventative medicine. We've got to fix the leak, which is another reason why I'm using this cartoon, since we're talking about leaky gut. And this is a common thing with intestinal inflammation or leaky gut. It's trying to figure out what's primary, what's secondary, so we can take a proper approach to fixing it. We can't talk about leaky gut without talking about the role of the microbiome, or all the bacteria that live in the horse's digestive tract. There's approximately 1 quadrillion bacteria that live in the horse's GI tract. That number is so big, it's not even in our common vocabulary. And that's why I wrote it out so you can see how many zeros that is. And of that 1 quadrillion, there's over 500 separate species of bacteria that normally live in the horse's digestive system. They'll be in his mouth, they'll be in his stomach, yes, the stomach, they'll be in his small intestine, they'll be in his large intestine. Now, obviously, the bacteria that live in the very acidic stomach are not going to be the same bacteria that live in the small intestine, and those are not going to be the same ones that live in the large intestine. So there is a compartmentalization of the microbiome as you go through the different parts of the digestive tract. But it's important to understand that of those 500 species, most of them are what are referred to as anaerobic. In other words, they don't survive in an oxygen atmosphere. So as soon as they're basically defecated out in the feces and they get exposed to the air, they very quickly die off. The reason I bring this up, What about commercial probiotic preparations? How do you take an anaerobic bacteria, put it into a probiotic preparation and expect it to survive? You can't at the present time. So almost all of your probiotic products that are available commercially are made up of aerobic bacteria. So you're only putting a very small proportion of the microbiome into a horse when you use probiotics. Used correctly, though, as you'll see, they can be extremely helpful and extremely effective. But you need to understand that, when you use a probiotic, you're only hitting the tip of the iceberg when it comes to actually affecting the overall microbiome in the horse. Now, if I have leaky gut, was that caused by a shift in the microbiome? Yes. If I have a shift in the microbiome, or is leaky gut the reason that there was a shift in the microbiome? Yes. So those two work together. If you've got leaky gut, you've got a shift in the microbiome. If you get a shift in the microbiome, you are now very susceptible to leaky gut. So that's why we like to try and keep the microbiome as consistent and as stable as possible. There's an awful lot of crosstalk between commensal bacteria and probiotic bacteria. Now, commensal bacteria that's the microbiome. That is the naturally occurring bacterial population in the gut, which includes both the anaerobic and the aerobic bacteria that live inside the horse. But the crosstalk between those two, really in any species, is not very well understood. We're getting some hints on how it works, and some of the crosstalk is extremely significant. But this is a very exciting area of research. And we're also learning that a lot of that crosstalk or transmembrane protein activity, it involves turning genes on or turning genes off that actually live in the stomach. For example, some of the colon cancers that are being studied now are actually caused by certain bacteria that upregulate certain genes. So it's a very exciting area for research, but at this point, we still don't know that much about it. As I mentioned earlier, in some cases, the protein isolates from a probiotic bacteria that has been killed are just as effective as giving the live probiotic itself. And that is because it's actually the peptides or the proteins from that probiotic which are affecting those protein complexes around the tight junction, which cause them to keep that tight junction closed. Now, from research, some of the specific interactions we have between bacteria in the gut, I'd like to share with you. Lactobacillus plantarum. We know that actually increases the protein expression, which causes that occludin protein to stay tight. Now, if you remember from the structure of the tight junction, that was the upper cross protein right above the claudin proteins that keeps that, actually cements those two adjoining intestinal cells together. So here's an example of a probiotic bacteria having a direct effect on those tight junction proteins. Okay, Bifidobacterium infidus, okay, also affects that protein ring complex. In other words, the proteins that surround the cells, surround that tight junction, which then signal those occludin and claudin proteins to pull together and cement those cells together. Our old standby, Lactobacillus acidophilus, one of the oldest probiotics that's in use today, also has a direct effect on the protein structures that cement those tight junctions together. Bacillus subtilis, again, helps those tight junction proteins pull together and keeps those tight junctions closed. People that have irritable bowel syndrome or know somebody that does might be interested in this one. This is a very specific bacteria. Bifidobacterium longum NCC3001, okay? For those that aren't familiar with the nomenclature, Bifidobacterium longum is basically a family of bacteria. The NCC 3001 identifies the specific bacteria in that family. Much like, my wife's name is Janice, I'm Bill. This would be specific. This would be specifically Janice, for example, rather than me. But this particular bacteria, the researchers in England have identified has a direct effect on the vagus nerve communication between the brain and the intestine. And it's now being used clinically in human medicine to resolve anxiety in patients that have irritable bowel syndrome. So instead of taking an antidepressant, they're giving you a probiotic. And to me, I find that very exciting work. Okay, special cases with the horse, equine metabolic syndrome. We know that horses that are insulin resistant have a much lower diversity of their microbiome. And remember from the first webinar, those of you that attended, a healthy microbiome is a diverse microbiome. So anything that's going to reduce the diversity, in other words, go from 550 species of bacteria down to 300 species of bacteria in that microbiome, means that your microbiome is not going to be as protective against pathogenic bacteria. It's not going to be as effective at keeping those tight junctions closed. It's not going to be as effective at regulating a lot of hormones in the gut. So diversity, very important for a healthy microbiome. So we know that insulin resistant horses have a lower diversity. So we know right there that something's not working the way it's supposed to. We also know that these horses have a reduced thickness of the intestinal mucus barrier. Now, in the intestine, this yellow line here, you can see it's labeled as mucus, that provides a protective layer between the intestinal lumen and those epithelial cells of the intestine. When that mucus layer becomes thin, that makes it easier for pathogenic bacteria or even commensal bacteria that are not supposed to make contact with those mucosal cells to now make contact with those intestinal cells and trigger them to open up and create leaky gut. In this diagram also, you'll notice a structure here called the Peyer's patch. Panna cells, those are all part of the immune system and gives you an idea of just how much the intestine or how big a role the intestine plays in the overall immune system. So we know that with horses that have insulin resistance, the proportion of bacteria that degrade that mucus layer actually increases. And we feel that's the reason why we get a reduction in that mucus layer. Now, researchers at Iowa State have shown that in swine, leaky gut triggers insulin resistance. Whether that holds true or not in the horse has yet to be demonstrated. But they've done some very interesting work where when these pigs get or develop leaky gut, they produce significantly more insulin, even though there's no biological trigger for them to do so. And they're still trying to figure out what is triggering or what is it about leaky gut that triggers this increased production of insulin, which then creates the insulin resistance. Physiologically, it does make sense that the same thing may hold true in the horse, but that research simply hasn't been done. So we can't, we can't run that flag up the flagpole yet, but just something to consider as we go forward. Okay, a few other notes on probiotics. Okay, numbers matter. Okay, if you're going to use a commercial probiotic, you're going to want to use a product that provides a minimum of 1 billion colony forming units per species. Okay, and colony forming units is how we measure how many bugs or how many bacteria are in a product. There's probiotic products on the market that might have 5, even 10 different probiotics in them, If the total of the 10 is 1 billion, that's not going to cut it. If you've got 10 billion from 10 different species, then assuming you'll have 1 billion of each one, that product's likely going to be much more effective. As we've noted earlier, not all probiotics need to be live to be effective. Keep in mind, from my experience, equine sourced is nothing more than a marketing gimmick. And I make that comment based on the fact that I have been involved in a couple of clinical studies where we've compared equine sourced probiotics with commercial probiotics to control diarrhea in foals. There was absolutely no difference between the two. They were both equally effective. So when people ask me about probiotics, my answer is look at the numbers. You know, how many CFUs, numbers matter. Look at, is it effective or not? What evidence do you have that this product is actually effective? Encapsulation, viability, not that big of a deal to me. I want to know, is it effective and how many bugs are we given? Also keep in mind that probiotics, or the benefits of probiotic, tend to be transitory. So in other words, let's say we've given a horse a probiotic for 21 days, and then we discontinue. And approximately 10 days after that, the benefit of that probiotic, or active benefit of that probiotic, will start to wane off. Now, hopefully the horse has balanced itself off where it can continue without probiotics. But if it does so, it's doing just that. It's doing it without the probiotic. So keep that in mind. So if you discontinue the probiotic, the horse starts to revert back to having difficulties. You may need to put them back on the probiotic. Okay. There's also something called a total fecal transplant, and that is exactly what it sounds like. You take fecal matter from a healthy horse, you transplant it into an unhealthy horse, usually via nasogastric tube, and you do that multiple times, sometimes over a couple of months. And when you do it that way, that alteration does tend to be permanent. Because again, keep in mind, when you do a total fecal transplant, you're getting all 500 species. That is, if you do it correctly, you're getting all 500 species, both the anaerobic and the aerobic bacteria, and transplanting them into the horse that requires it. One particular probiotic I'll share with you tonight is a Bacillus subtilis. Again, this is a specific one, Bacillus subtilis PB6. This particular probiotic is been demonstrated to control Clostridia difficile and Clostridia perfringens. Now, Clostridia in the foal is very, very serious. It creates severe diarrhea. These foals can get dehydrated, their electrolytes get out of balance, and if not treated successfully, they'll actually succumb to it. But more so than the foal, there's now evidence to suggest that while adult horses don't tend to get diarrhea per se from a Clostridial infection, they do develop leaky gut from that Clostridia infection. And this particular probiotic, Bacillus subtilis, can substantially, significantly reduce the Clostridial population in the horse. Now, and this is a problem with long-term antibiotic use. When horses start to develop diarrhea or tend to develop intestinal problems after they've been on antibiotics for a while, it's usually because the Clostridia is increasing in the population. So good idea to put horses on probiotics anytime you're under an antibiotic protocol. But this particular Bacillus subtilis not only helps reduce the Clostridia, as we mentioned earlier, it also has direct action on the tight junction to help keep them closed. Now, in treating leaky gut, butyrate is a great tool to have in your toolbox. Butyrate is used as an energy source by those epithelial enterocytes. So normally those mucosal cells are replaced about every 2 to 3 days in the intestine. By increasing the butyrate concentration, we can actually shorten that up. And so if an intestine gets inflamed, we can replace those damaged cells with healthy cells much quicker. Butyrate also helps keep those tight junction closed by acting on those tight junction proteins. The problem that we've had previously with trying to find a way to dose butyrate is twofold. One, it's not palatable at all. It smells horrible. And I would not take it raw. Our horses will not consume it without it somehow being made palatable. The other problem we have, butyrate is what's referred to as a volatile fatty acid. It's a very small molecule. So if you were just to take butyric acid or butyrate, dose it in a horse, say you didn't give the horse a choice and you just dosed it via paste or something like that, as soon as it hit the stomach, it would immediately be absorbed. And that's not where you want it to work. You want it to have its action in the lower part of the small intestine, in the large intestine. So we now have a commercial butyrate product, which is a slow release product. So it can get back to the small intestine and the large intestine. And it's also been coated and flavored. And 99 horses out of 100 surveyed said they'll eat it. So it's a great new tool we have in the toolbox that we didn't have even, 3 years ago. Colostrum peptides or casein peptides. Really should be no surprise. When a foal is born, his gut's wide open, isn't it? So that's how he absorbs the antibodies, immunoglobulins, and that's how he develops his immunity from the colostrum. But as soon as he begins to absorb those immunoglobulins, that intestine starts to close up. Okay, what's triggering that closure of the gut? Those colostrum peptides. So we can use these colostrum peptides even in adult horses to help trigger the closure of those tight junctions as well. Glutamine, been well established that it's needed for normal tight junction function. The mineral zinc, very important for intestinal health. Lipids we have to be careful of. I've dealt with a lot of horses that have been on coconut, some type of coconut product. And I've also put horses on fish oil, which is the fatty acid EPA, comes from fish oil. These medium chained or the polyunsaturated fatty acids act as great anti-inflammatories for an intestine that is slightly inflamed. But if I've got a horse that's got full-blown leaky gut, they may not have diarrhea prior, but when you put them on these type fats, they will, within 2 days, have almost projectile diarrhea. When I run into that situation, I know I've got more than just intestinal inflammation. I know I've got leaky gut, in which case then we have to pull those fats out of the diet, and we have to take a different approach. Surfactants, emulsifiers. I know we're running out of time, so I'm going to speed it up here. Not so much a problem with our horses, but if you look at how many surfactants and emulsifiers that people consume on a daily basis, and especially here in the United States, it's a little bit scary. And there's been some work done by Georgia State University, which indicates that those emulsifiers and surfactants break down that mucus barrier that we talked about, primarily in relation to insulin-resistant horses, and have actually shown where you can get increased diabetes in people by having too much of those in your diet. But that's almost a topic for a whole nother webinar. Mycotoxins will also trigger leaky gut in horses. Keep in mind, your forage, not just the grain, can be a source of mycotoxins. So if you've got a horse, very low level of activity, he's not stressed out, and then he acts like he's got leaky gut, and you're saying, well, how did this horse get it? Mycotoxins is a possibility. So what do? We provide as much fermentable fiber as possible. You can't get anything better than fresh pasture grass for gut health. Now, obviously in the wintertime, that's not a possibility. But if you can give the horse access to pasture, that's great. Obviously, some of you may be going, now, wait a minute, what about the IR horse? Well, the insulin resistance takes precedence. So you've got to manage that insulin resistance first, and then we'll find other ways to handle the leaky gut. Beet pulp, when it is fermented in the hindgut, it produces a greater proportion of butyric acid. So anytime I'm dealing with intestinal inflammation, my go-to feed is Triple Crown Senior because it is a beet pulp-based feed, and I'm looking for that extra butyric acid production. Take the grains out of the diet as much as possible. High fiber, low starch. Use probiotics. Use prebiotics. Okay. If I do have an insulin-resistant horse, and I'm simply dealing with, a low level of leaky gut, I'm going to put that horse on a fish oil product, not only for the anti-inflammatory aspects of the intestine, but we also know that over long term, fish oil will actually improve insulin sensitivity. It's not going to fix the horse, but it'll improve it. So what is my approach? First thing, as you may have already picked up on, you got to have more than one tool in the toolbox. If all I got's a hammer, then everything looks like a nail, so to speak. So my go-to program is our 21-day hindgut health program. This is a probiotic, prebiotic. We start with paste to jumpstart normal fermentation in the hindgut. Then we go to a powder. We also use our fish oil factor, which is granular. For those that aren't familiar with it, it's a granular product that mixes in very well with the feed. Most horses, especially off-track thoroughbreds, they are very common to have intestinal inflammation or low-grade leaky gut. Majority of them will respond positively to the 21-day hindgut program, and they'll usually stay fixed after that. Excuse me, just a second. Had a little itch. If one of two things happens, if the 21-day program with the probiotic, prebiotics, and the omega-3s is only partially effective, totally non-effective, or as I mentioned, in some cases, when we put the fish oil factor into the program, all of a sudden the horse breaks with big time diarrhea, then I know I've got more serious leaky gut, in which case the probiotics aren't necessarily going to be that effective. And obviously neither are the omega-3s. So then I'm going to go to a product called GI Calm. This product incorporates those colostrum peptides, the glutamine. It also helps that intestine produce serotonin. Keep in mind, there's more serotonin produced in the intestine than there is the brain. Okay, very important neurotransmitter for the gut. So if I can trigger the gut to make more serotonin, it kind of levels out and calms down the entire intestine and allows these other components to work. It's also going to have an effect on that vagal nerve response that we talked about. It includes that slow release butyric acid, also includes that Bacillus subtilis. Now, go through a couple of case studies with you. Some of you may find this the most interesting part of the webinar. The first one is a stallion by the name of Deep Impact. He's been the leading sire in Japan for many years. He was a Triple Crown winner in Japan, and Japan doesn't have many more Triple Crown winners than the United States does, so that is a big deal. He's currently insured at $150 million, and based on what he generates in the breeding shed, he's actually worth every penny of that. Now, this horse presented with a low body condition score. He was a body condition score of 4. He was extremely irritable, very hyperreactive. He was not mean by any means, but he didn't want to be touched. He didn't want to stand still. And any stimulus of any type, he would just overreact to. So even though he wasn't necessarily mean, you had to be careful that he didn't end up on top of you when you were handling him. Very susceptible to skin infections. Any type of rain rot, scratches, just general dry skin, fungus, you name it, he'd get it. It'd be very difficult to clear up. And you can imagine, here you've got this $150 million stallion with, skin that doesn't look so hot. The owners weren't real happy. Also had a very poor appetite. Just wouldn't eat, very picky eater. They'd already put him on GastroGuard or omeprazole. We put him on our 21-day hindgut health program. Only helped a little bit. So that told me through experience, okay, we were probably dealing with more bona fide leaky gut. So we switched him off the 21-day program to GI Calm. Within 45 days, his appetite became normal. And within a short period of time, he put on weight, his allergies or the skin condition cleared up, his whole attitude changed, and he's actually fairly pleasant to be around. So that's success story number one. Case study number two, 30-year-old retired show pony with Cushing's. Positively diagnosed with Cushing's, been treated appropriately from a medication and a feed standpoint for over 2 years. All of a sudden, broke out with spontaneous diarrhea. Veterinarian did, what any veterinarian would do. Treated it with various approaches. Nothing worked. We put the horse on GI Calm. Within 5 days, we had normal manure. Pony remained on GI Calm for 30 days. We were happy, so we discontinued it. The pony continued on for 60 days, and then all of a sudden broke with diarrhea again. So this time we just put it back on the GI Calm, fixed it again. So now we kind of use the GI Calm as needed. Now, why does this pony break with diarrhea that only the GI Calm will fix? In my opinion, it's a Cushing's horse. It's spiking cortisol, okay? Stress produces cortisol. In this case, Cushing's is producing cortisol. The cortisol, major stimulus for breaking those tight junctions apart. Pony gets leaky gut, bingo, we got diarrhea. So that's something that simply has to be managed at this point. We're not going to fix it. Next one, this was an 18-year-old gelding pasture buddy. This horse came to the owner knowing that it had severe diarrhea for over 2 years, which is why it was a quote-unquote free horse. But she got it as a buddy for her event horse. Poor guy worked great for this. He's very calm, very sweet horse. Notice that even though he's got severe diarrhea, he's still got a body condition score of 6. So he's still able to assimilate nutrients. So that kind of tells us we've got something going on in the hindgut where he can't reabsorb the water. The poor owner was washing this horse's back end every day because it was so messy. They've tried various things, nothing worked. So we went straight to GI Calm. I had enough experience. When you see a case like this, probiotics are not going to fix it, okay? So we went straight to GI Calm. After 30 days, we went from watery diarrhea to cow pies. After 120 days, we finally went to soft road apples. After 180 days, we finally had normal manure. And now the horse is able to be maintained on a probiotic. But he's got a lot of scar tissue in that gut, and he's always going to be right there on the fence in terms of breaking with diarrhea or not. Breeding stallion with recurrent colic. This particular colic was a small intestine situation. He'd impact a little bit, or his gut would just stop moving, or gut stasis. Peristalsis would just stop. Each time he colicked, he was treated medically very successfully, but obviously it's a very valuable horse. Owners were getting very concerned that, what about next time? Is it going to be more serious? So we brought in, the GI Calm. We switched him off a fairly heavy grain diet, put him on Triple Crown Senior, put him on GI Calm, made a big difference. And of course, every time I present something like this, I knock on wood, but he has been colic free now for 6 months. And then finally, a case that I call acute leaky gut. I know I'm going over, but I present this one because I think some of you can relate to it. This was a combined driving horse, no problems whatsoever at home. Every time the owner took this horse off the farm, whether it was simply for training or for showing, the horse would present with acute projectile diarrhea and develop a non-compliant attitude. Let me draw your attention back to the fact this is a driving horse. So you can imagine this was a very uncomfortable situation. We didn't use GI Calm. We didn't use the 21-day hindgut on this horse. What we did was we put this horse on a calming focus product, and before the horse ever left the farm, and it fixed it. So when the horse was off the farm, he remained compliant, did not get the diarrhea. But this horse is a perfect example of how the brain, the emotions, the nervousness, via that vagus neural stimulation of the gut, can actually create leaky gut. It creates hypermotility, which in turn creates leaky gut. So I apologize for going over. I want to thank each and every one of you for attending. And as a thank you for attending, you'll notice that for the next 24 hours, we're giving a 10% discount on either the 21-day hindgut health program or the GI Calm product from the Equivision website. Just enter in the code gut health. So Chad, I'm going to turn it back over to you.
All right, great. Thank you, Dr. Vandergrift. That's a lot of great information that you provided us tonight. We are going a little bit over, but if you guys have questions, you can put them into the chat box on the right-hand side of your screen again. We do have a few questions that came in. One was on Cushing's. It says, my horse, you did have a case study on there, but she said, my horse has Cushing's. Is there something I should do preventatively before we see, any specific signs of, leaky gut syndrome on there?
Preventatively, I'm assuming that if the horse is positive for Cushing's, you're on some type of medication to try and control, the hormones and so forth. High fiber type diet. The next question would be, do we have insulin resistant involvement or not? If we have insulin resistant involvement, I'd recommend, this is where the Triple Crown Senior is actually sometimes a little bit contraindicated because it's 10% fat. And my experience has been when I've got a Cushing's horse, it's also insulin resistant, I need to go to a lower fat type diet, but I still like, beet pulp incorporated somewhere in the diet. And I would use some type of daily probiotic. That's going to help maintain health of the gut. I would not, use GI Calm at this point. That's primarily used to treat a problem, not necessarily prevent it. So, I'd say maintain the medication, watch the diet, use a probiotic. And by the way, probiotics need to always be combined with prebiotics. So when I say probiotic, I'm assuming that the product's going to have prebiotics in it as well. But from a prevention standpoint, that's about all you can do. And just like the pony in the case study, from there on, you kind of have to manage that horse based on how it presents from there on.
Sure. Okay, I have another question from Megan. She asked, you mentioned more about performance horses, but what about broodmares? I have a broodmare that is, increasingly cranky as she gets closer to her due date. Don't really want to put her on ulcer medicines, but is there something we can do to, is there something that, affecting her, leaky gut wise, or is it just pregnancy issues?
Yeah, it's a good question, Megan, because many times with brood mares, it is just the fact that they're getting uncomfortable. Now, let me back up. I'm keying in on the fact that you said she gets cranky as she gets close to the due date. And based on that information, I'm thinking it's probably more just a general discomfort, from the foal getting large, taking up more room in the gut. That would not necessarily be a leaky gut situation. However, again, the first thing I would do would be to go with probiotics and maybe even a fish oil product, because sometimes we see that when we use probiotics in combination with the fish oil, it will have a calming effect, or shall I say a leveling effect, on some of these horses, including brood mares. But I think they're the primary problem, because I made a point of that. You got to always figure out what's primary, what's secondary. I think the primary problem there is she's just uncomfortable because she's so pregnant. Yeah.
Sure. Absolutely. All right. I think we'll take one more here. Kim asks, should vaccines be given to a horse that has an active intestinal issue?
Debatable.
Mhm.
Because with that, as you know, when you give a vaccine, you're triggering an immune response. You will find some horses that will get colicky following vaccination. Those horses, what that tells me is those horses probably had some degree of leaky gut prior to getting the vaccination. But unfortunately, you may not know that. If the horse isn't presenting with any of the things that we talked about tonight, there's no way you'd know it, so you'd go ahead and vaccinate. But it's another reason why with horses that have a history of a negative reaction or an intestinal reaction to vaccines, it's common to follow the vaccine with some Banamine, to try and keep the gut calm. But if the horse is already presenting with some of these leaky gut symptoms, or he's already presenting with some allergies and so forth that you think might be related to intestinal function, I'd probably work on that prior to giving the vaccine for two reasons. One, you don't want to put the horse into intestinal discomfort. But number two, if the immune system is already a little bit on the dysfunctional side, you're not going to get as effective response from the vaccination as you will if you wait and get the gut cleared up and then give the vaccine.
Okay. Sounds good. Well, we are about 10, 12 minutes past 8:30. So I just want to thank everybody for being on tonight. If you have questions, I'm sure you can always shoot Dr. Vandergrift an email or send us a Facebook message on there, and we'll be happy to get some answers out to you. Again, thanks for being on tonight. Don't forget, for the next 24 hours, you can get a 10% discount on the 21-day Hind Gut Health Program and the GI-COM using the code GUTHEALTH on the website. Dr. Vandegrift, thank you for great information as always, and thanks for everybody for showing up tonight.
Okay, well, thank you so much for everybody participating. Thank you.
Thank you. Have a good night.
Bye.